No matter what happens to President Obama's health care reforms after the November election, the disjointed, costly American health care system must find ways to slow the rate of spending while delivering quality care. There is widespread pessimism that anything much can be achieved quickly, but innovative solutions are emerging in unexpected places. A healthcare system owned and managed by Alaska Native people has achieved astonishing results in improving the health of its employees or enrollees while cutting the costs of treating them. At a recent conference for health leaders from the United States and abroad of the Native-owned Service Central Foundation in Anchorage, the Alaskans described techniques that could be adopted by almost any health organization willing to transform its culture. Such a transformation would require upfront financing for training data processors and the like, but the investment would rapidly pay off on reduced costs. The foundation, established in 1982, provides primary outpatient care to Alaska Natives and American Indians who had previously been the responsibility of the federal government's Indian Health Services, which serves 15,000 enrollees in the Anchorage area and 10,000 more scattered in remote villages, most reachable only by air on an annual budget of $200 million. It also jointly owns and manages with a consortium of native tribes a small hospital and has built a modern campus of outpatient clinics with the help of loans, grants, bonds, and retained earnings. About 15% of its revenue comes in what amounts to an annual block grant from the revenue and the Indian Health Service, a source unavailable to most health systems. Another 45% comes from Medicaid, Medicare, and private insurers, and the rest from philanthropic grants. As the Consumers or Commerce Department noted when it gave South Central a National Quality Award in 2011, known as the Malcolm Baldrige Award, the foundation has achieved startling efficiencies. Emergency room use has been reduced by 50%, hospital admissions by 53%, specialty care visits by 65%, and visits to primary care doctors by 36%. These efficiencies, in turn, have clearly saved money. Between 2004 and 2009, South Central's annual per capita spending on hospital services grew by a tiny 7%, and its spending on primary care, which picked up the slack, by 30%. It is well that the integration of a wide range of data measures, medical and financial, have South Central's data mail doctors coughing up easily understood graphics showing how well doctors and the teams they lead are doing to improve health outcomes and cut costs compared with their colleagues, providing them with action lists of things to do and how to do them, and mentoring also. It is certainly a great system in Alaska. Focusing on the needs and convenience of the patients rather than of the institution or the providers, the facilities feature rooms where providers and families can chat as equals on comfortable chairs. What's that? What?
No, I got it.
We took it 5 weeks ago.